Thank you for that great introduction, and I'm excited to be here. I'm excited to talk to you tonight about lifestyle medicine. But before I do that, I'd like to just tell you a little bit about my journey and how I got here. I went to medical school at Hahnemann in Philadelphia, and one of my psychiatry professors was Paul Silver, who some of you may know, before he went into medicine. And I was trained in primary care internal medicine. I came to GW in 1993 to do a fellowship in academic primary care and get a master's in public health. And I've really been privileged to have what I'm now calling my first dream job, because I think this is going to be my second dream job, for the past 30 years at GW, teaching public health and preventive medicine in the School of Public Health, doing a lot of different things from health IT over the years, and really not discovering my overriding passion until I discovered lifestyle medicine. And that wasn't a straight line. My first interest started with preventive medicine, and then when I had a rough time in my life and I got into running and realized, wow, that's really transformed my mental health. I wanted to study that, and how can we get patients to run more, and that's where my research, or not run more, but be more active on a sustained basis. That's where my research interest is. And I started helping patients with that. I went to a conference at the American College of Preventive Medicine, and I heard a gentleman called Michael Greger talk about food as medicine. And I was not impressed. I thought he must be some sort of a snake oil salesman, because how could I, at this point, 20 years into my career, not have heard about this? So I did what every good internist does. I went back and I dug into the evidence, and it turns out there's a tremendous amount of evidence, and it's not new evidence. It's just that for reasons I won't get into tonight, it wasn't part of what we were taught in medical school. So I started practicing in my own patients. I learned more about lifestyle medicine. I took a course at an online course at Cornell in plant-based nutrition. I got board certified in lifestyle medicine in 2019, started seeing how it has transformed my patients, and then I realized this really has to be part of every doctor's training. There shouldn't be just a couple of doctors who are trained in lifestyle medicine. This should be the foundation of medicine. And so the area where I had the most influence was in graduate medical education. So we brought a formal lifestyle medicine residency curriculum to GW, creating a pathway so residents, when they finish their training, could be trained in internal medicine and lifestyle medicine. Had less success with the medical school, but the students found out about it and got interested. And I'm happy to say that a grassroots movement of the students is changing the medical school curriculum. So that's how I got to where we are today. And what I want to share with you is what I've taken away from after 30 years of practicing at GW. And I want to share with you that I've become convinced of one thing. The most powerful treatments that we have are not prescriptions, they're behaviors. And I want to show you what lifestyle medicine is, why it matters now more than ever, and what you can begin doing immediately to improve not only your lifespan, but your health span. So the average American lives 76 to 79 years, but they spend 10 to 15 of those years with chronic disease or disability. 60% of adults have one chronic disease, and this is things like high blood pressure, cholesterol, cancer, diabetes. 40% have 2 or more chronic diseases. And medicine has extended lifespan, but we've not extended health span at the same rate. And what do I mean by health span? That may be a new term. So health span is the part of your life that you are able to do what you want to do without having to think about your health. And I want to share this slide with you. This solid line is kind of what happens, the natural trajectory of life without medicine. Gradually, at some point in middle age, you start to decline. When you get below this dotted line, that's when you're thinking every day about your health, and it's a main driver of the way you make decisions. And then eventually that declines, and when you hit the bottom here, you die. Most of modern medicine that I was trained in led to this second line. We don't really do much to change the trajectory of health span, but when we get near the end of life, we're really good with intensive care and surgery and high technology to extend life. But we haven't really extended health span. The promise of lifestyle medicine is the dotted line to the right. Really, they call this squaring the curve. You stay healthy and then have a terminal decline. One of my mentors referred to this as the goal is to die young as late as possible. So,
would you say that again?
The goal is to die young as late as possible. So, the good news is that most of these chronic diseases that limit independence, heart disease, diabetes, stroke, dementia, are not random. They accumulate slowly over decades, and the really good news is they're largely modifiable. So what is lifestyle medicine? Well, let me start by telling you what it's not. It's not alternative medicine, it's not supplement-based medicine, it's not biohacking. It's the systematic application of what the strongest human outcome data tells us, that behaviors and lifestyle choices matter. It's the use of a whole food, plant-predominant diet, regular physical activity, restorative sleep, managing stress, avoiding risky substances, and maintaining social connection and having healthy relationships, not only to prevent disease, but to treat disease, and in some cases, and I'll show you an example of this, reverse chronic disease. So these are the pillars of lifestyle medicine, and each of these pillars independently predicts longevity, but together they're profoundly powerful. So let's look at what the data shows for some of the pillars, and we'll start with diet. So if you look at the leading cause of chronic disease in the US and the underlying leading cause of mortality, it's not tobacco, it's not infectious disease and sanitation, it's not air pollution, it's not even weight, it's diet. And the most important dietary risks are diets that are low in fruits and vegetables, low in nuts and seeds, high in sodium, high in processed meats and other processed foods, and high in trans fats. So with that in mind, I want you to think about one of my favorite quotes. Every meal is a short-term investment in how you feel and perform, a mid-term investment in how you look, and a long-term investment in your freedom from disease. So with that in mind, let's think about what the American diet is like. The standard American diet, and we jokingly refer to the acronym as SAD, because it really is 60% of the calories come from ultra-processed food. And we know there are lots of problems with ultra-processed food. They're engineered to stimulate us to eat them beyond when we would normally be satisfied by optimizing the amounts of sugar, fat, and salt. They have too much refined sugar, unhealthy fat, and salt. And they don't have much of something that's really important in a lot of ways for our gut microbiome and other things, and that's fiber. So we know that dietary quality is associated with up to a 20% reduction in all-cause mortality. Higher fiber intake reduces mortality by 22 to 33%, and replacing just 5% of your calories from animal protein with plant protein reduces mortality risk by 10 to 15%. 5% of your calories. Imagine what happens if you replace more. Now, we debate diets endlessly, but what's not debated in the literature is this, that higher intake of minimally processed, fiber-rich, plant-forward foods consistently lower mortality. Fiber is not glamorous, but populations with the highest fiber intake live the longest. The average American consumes 15 grams of fiber per day. Optimal is 30 to 40 grams. And if you think about it, that gap alone explains an enormous amount of chronic disease. Sorry. There we go. So, a whole food plant predominant diet lowers blood pressure by about 5 to 11 millimeters of mercury. It slows atherosclerosis progression, and actually in some trials with Dean Ornish and Caldwell-Esselstyn, it's actually been shown to reverse coronary artery narrowing. And plant-based diets improve insulin sensitivity and reduce A1C. But it's not all about diet. Another huge opportunity is with physical activity. So let's start thinking about another one of my favorite quotes. The current human genome requires and expects us to be highly physically active for normal functioning. Humans have been on this planet for over 100,000 years. And most of that time, we were living in an environment of scarcity where we had to walk and run to get our food. We ate mostly plants, and when we got lucky, we ate an animal. And that's what our genome is designed to thrive in. That's changed relatively recently. It's only been a couple hundred years, the Industrial Revolution and the IT revolution. And now we're a lot more sedentary than we've been before, and we have a problem of food overabundance, not food scarcity. But our genes haven't changed. Our genes are still expecting us to be highly physically active and limit our calories. So we need to think about how physical activity can interact with that genome. And we know that being physically inactive carries a mortality risk that's equivalent to smoking. Cardiorespiratory fitness or aerobic fitness is one of the strongest predictors of survival and better than some of the things that we think about, like cholesterol level. And the news isn't good, that without trying to prevent it, adults tend to lose 3 to 8% of muscle mass per decade over age 30 if they're not resistance training. And low grip strength predicts mortality more strongly than high blood pressure in some studies. And before you go home and get one of those grip trainers, grip strength is really just an easy way to measure total body strength. So you want to train your whole body, not just your grip. That's just the easy way to measure it, and it's going to be part of what we do for all of our patients in this practice. So the takeaway is that muscle is not just a cosmetic tissue, it's metabolic currency. Loss of muscle or sarcopenia predicts frailty, it predicts insulin resistance, it predicts cognitive decline. And yet fewer than 25% of adults perform resistance training or strength training twice a week. If you take nothing else away from this talk and make no other changes, if you did nothing else but strength train twice a week and walk daily after meals, your long-term risk profile would change dramatically. This is just some examples of where physical activity can make a difference. Endothelial function, the endothelium is the lining of the blood vessels, and that's what stops working properly and leads to heart disease and cognitive decline. Exercise improves that. VO2 max is a measure of cardiorespiratory fitness. Insulin sensitivity is also governed by how much muscle you have and how you move your muscles, in part. We know that regular physical activity will lower your blood pressure. It will decrease episodes of atrial fibrillation. It improves heart failure, exercise capacity, and it decreases insulin resistance, decreases A1C. So let's move to the sleep pillar. A few words about sleep, which I think of as the foundation of good health. Sleeping, just some examples of how sleep interacts with our health. Sleeping less than 6 hours per night increases the risk of obesity by 55%. Multiple studies have shown, and this will blow your mind, if you sleep less than 7 hours, you tend to eat 500 to 700 more calories the next day. So if you're trying to lose weight, how are you supposed to do that with 500 to 700 extra calories? Sometimes, if you're not losing weight, you need to think more about your sleep. Decreases type 2 diabetes by 28%. 1 week of restricted sleep reduces insulin sensitivity. And chronic sleep deprivation increases dementia and cardiovascular disease. And in fact, multiple studies have shown that the one night in the year where there are more heart attack deaths than any other is the night that we set our clocks ahead and lose an hour. Because when you apply that to the whole population, everybody getting less sleep, there's just, it has an effect on cardiovascular disease. Bullet point that's not up here is sleep has a strong effect on immune function. That's important not only to prevent things like colds and flu, and another one of my favorite studies showed that in people who slept less than 6 hours when they got the flu shot, had a 50% lower response in antibody production than people that slept more than 7 hours. But your immune system is also the main defense system that prevents cancer. So not getting enough sleep increases cancer risk. So sleep isn't passive, it's metabolic regulation. You know, we would never prescribe a medication that increases diabetes by...
Personnel, OB-STAT, Building B, Bravo, 3A, Labor and Delivery, Room 4. Attention personnel, OB-STAT, Building B, Bravo, 3A, Labor and Delivery, Room 4.
It's nice to not have to run out of the room to that. So we would never prescribe a medicine that increases diabetes risk by 30%, yet many of us voluntarily sleep 5 to 6 hours a night or less. In fact, when I came to Washington, I came to believe that not sleeping was a badge of honor in this town. But it really does have significant consequences. Sleep is a performance enhancer for every other pillar. Social connection. Humans are biologically wired for connection. Isolation is inflammatory, connection is protective. One of the strongest predictors of longevity in global populations, and we know this from the Blue Zone, some of you may have seen the National Geographic special or read the books, is not just diet and exercise, it's belonging. Chronic loneliness carries a mortality risk comparable to smoking 15 cigarettes a day. Strong social connection heals that. You have a 50% increase in the likelihood of survival. Chronic stress elevates inflammatory markers linked to cardiovascular disease. So that connection which a previous Surgeon General called an epidemic of loneliness. That's important. So I'm not going to go through the rest of the pillars, but I want to just say that none of these behaviors works only in isolation. They're multiplicative. Healthy behaviors compound. People who follow these 4 lifestyle practices, healthy body weight, regular physical activity, avoiding tobacco, improving diet by eating more whole grains, fruits and vegetables, fiber, they avoid 80% of all heart disease, 91% of all diabetes, and they gain up to 10 additional years of life expectancy. So this is very powerful medicine. So in order to illustrate for you what's possible, I want to tell you about one of my patients. This is one of my earliest patients, and it was his journey that really prompted me to want to share this and learn how to share this with more patients. And he's a patient who did get better. So MW was a 38-year-old man, and this is going to start to feel like a doctor conference, so bear with me. But I think getting into the details is important because some of these details might sound familiar to all of us. So he was dealing with high blood pressure, high cholesterol, fatty liver infiltration, heartburn, obesity, asthma, and anxiety. And he came to me one January newly diagnosed with type 2 diabetes. He complained that he was tired all the time, he was irritable, he didn't sleep well, he woke up sweating. His diet was the standard American diet, and I will remember this so clearly. He actually said to me, "I will die before I stop eating meat." And he was sedentary. Now, this is all despite the fact that he was on a high dose of a cholesterol-lowering medicine, 2 blood pressure medicines, and 2 anxiety medicines. He came to me before he'd been started on any diabetes medicines. His weight was 210 pounds, BMI of 33 classifies him as obese. His blood pressure was well controlled on the medicines. His cholesterol, the LDL, is the one we worry about, which should be lower than 100, despite being on a lot of medicine, was still 112. And hemoglobin A1C, for those of you who are familiar with diabetes, know that this is a number that tells you what your average blood sugar is over a 3-month period. Normal is less than 5.7. 5.7 to 6.5 is pre-diabetes, and over 6.5 is diabetes. And he was 12.7 when he came in. So this was an issue. And fortunately, I had begun to learn a lot about the potential of lifestyle medicine, and I approached his case differently than I would have for most of my career. And I told him, you know, you're at a crossroads. There are 2 ways that we can handle this, and I want to explain them to you, and you can tell me which path you want to go down. I'll tell you first about the path I would have followed if you'd come in 2 years ago, and what I've been doing for the last 20 years. And that is, we'll start you on a medicine to lower your blood sugar. We'll talk about avoiding carbs. Probably in a couple of years, we'll have to add some more medicine. Sometimes you need insulin when you go down that path. Sometimes we need medicines to treat the side effects of your medicines. The good part is, all you have to do is make minimal lifestyle changes and take medicine. The bad part is you're going to be on medicine the rest of your life. So the other pathway is the lifestyle change pathway. The advantage of that pathway is you may never need medicine, or if you do, you'll need a lot less. But the big disadvantage is you have to make significant change to your lifestyle. Little changes like taking the skin off your chicken aren't going to do it. So it requires a real investment. But the payoff is potentially tremendous, because the changes you're going to make to treat your diabetes are also going to help prevent cancer. They're going to help prevent chronic kidney disease. They're going to help prevent dementia. They're going to help your blood pressure. I said, which feels like something you want to try? And he said, well, I don't love this idea of giving up meat, but I can do anything for a month. Let's try it. So the plan we agreed on was that the dietary change he would make initially was a whole food, plant predominant diet. And there's no food that I'm going to tell patients they can never, ever have again. What's important is what you do most of the time. Later, we included some time-restricted eating along with that to help with weight loss. From an exercise perspective, he was completely sedentary. We started with a goal of just moving his muscles after a meal. If you're trying to lower your blood sugar, if you move your muscles when your blood sugar levels are higher, that lowers your blood sugar, and that walk after a meal is more effective than that same walk at some other time. Ultimate goal was to get him up to 150 minutes a week of moderate or 75 minutes a week of vigorous exercise, plus some strength training. From a resilience or stress management standpoint, exercise was the prescription, and getting good sleep. And we helped him with that. And social support is always important for these kinds of changes, so he enlisted the help of his family and friends in making these changes. So before I show you the results of his labs, I want to tell you what we did to his medicine. Over the 6-month period, we decreased the first one, atorvastatin here is his cholesterol medicine, from 40 milligrams to 10. And you'll see with that decrease, his cholesterol actually got better on less medicine. Lorazepam is like Valium. It's an anxiety drug that's kind of a sedative. He didn't need that anymore. His sertraline, which is like Prozac, he still kept at the same dose, and his blood pressure medicines were at the same dose, but as you'll see, his blood pressure was improved. So, what happened? His weight decreased some, although you can't account for these other changes just with weight loss. His blood pressure on the same medicine improved significantly. His hemoglobin A1C went from really high to normal, meaning no diabetes, no pre-diabetes, in 6 months without any diabetes medicine. His LDL cholesterol, which is the bad cholesterol, I said it should be under 112. Well, he was 112 on 40 milligrams of Lipitor, and he dropped to 53 on 10. And this last measure is a liver damage enzyme, and he had this fatty liver infiltration, and that got better. So he did lose some weight, not a tremendous amount, 16 pounds. His blood pressure went down 14 points. His cholesterol went down almost 60 points. He reversed his diabetes. He improved his liver inflammation. His heartburn went away completely. His anxiety improved. His sleep increased. His energy level improved. And most important for him sustaining this, he felt better. He was more active with his kids, more engaged with his wife. And this is the other quote he said that I remember. I actually feel like I'm living more. So that had as profound an effect on me as it did on him. This is the kind of medicine I want to practice. Now, he was in his 30s, but it's never too late to change your trajectory. Many people assume that by the time they're in their 50s, 60s, or 70s, the trajectory is already set. The data tells a different story. In large prospective cohort studies, people who adopt healthy lifestyle behaviors, even in midlife, gain meaningful years of life and, more importantly, years free of disability. Fitness improvements at virtually any age reduce mortality risk, and I have personally seen patients in their 60s or 70s reverse prediabetes, reverse diabetes, improve blood pressure, reduce medications, regain energy, and rebuild strength. The body remains remarkably adaptable, and that small, sustained changes compound over time. The earlier you begin, the greater the return, but it's never too late, and your trajectory isn't fixed. So what can you all start doing tomorrow? Well, I already talked about strength training. So try to strength train twice a week, walk 10 minutes after dinner, add 10 grams of fiber daily from whole foods, and here's a cheat code. Animal products never have fiber, so it's got to be plant products. And prioritize 7 to 8 hours of sleep. Now, I know that making sustainable lifestyle change isn't easy. And most doctors, after they've written the prescription for a cholesterol medicine, say, and you really should eat better and exercise more. And then we're surprised when we leave it at that patients don't. But what are you supposed to do with that, right? What does that even mean? And what we have learned and what we teach our residents and how I practice is that you need 3 things to make meaningful lifestyle change. You need the knowledge of what your personal risks are or what you're currently dealing with, and you need to understand how lifestyle interacts with that. But that knowledge isn't enough. In order to sustain change, you need to have the right attitude about it, you need to find the right motivation, and even that isn't enough. The final thing that you need is you need the practical knowledge of how to make this work in your life, because you've probably been doing something else for decades, right? And when you have those 3 things, when you know what to focus on, when you've got the right attitude about how you're approaching it, and when you're supported with the tools you need to make sustained change, I have been amazed at the changes that people can make. So why doesn't that happen in traditional medicine? Well, some of it is time. You know, Jim highlighted this at the beginning. In 15 or 20-minute visits, when we are reacting to a problem that's already there, there's not time to do this. This takes time. To do this well, you need to spend the time. You need to answer the questions. You need to identify the barriers. You need to help with motivation. That takes time. And the need for that time is probably the biggest reason that I'm moving to a concierge practice, because we have the time. And that's a gift for me and also for all of you. So I practiced in this traditional medication-focused system for decades, and it's good for acute care, but it's really not designed for behavioral transformation. As I said, I think lifestyle medicine should be the foundation of medical practice. I am not in any way anti-medicine or anti-technology. I use all of those things. But this is where we should start. And lifestyle in my practice is not a side conversation, it's the foundation. If your goal is to extend not just your years, but your vitality, this is what we focus on. So thank you for your time, and I'm happy to take questions.